And taking the disc out, that seems like normally that can be a separate surgery.
Yes.
And then the third one was
Screws and rods.
screws and rods.
Which
Yes.
is this one here.
Yes. Okay.
So what would you recommend in this case? Or do you?
There's two other ways to do a fusion.
Okay.
Okay.
Go ahead.
The other way is to do the fusion all from the back. So what we do is we go in the back and we just cut the bone out in the back.
Okay.
And from the back we scoop out all the disc. Okay?
Okay.
After you scoop the disc out, you can put a cage in, a spacer, but it's not as big as the spacer you put in the front because the nerves are in the way. So what we do is put two small spacers on each side and then put the screws and rods in. That's the option number 2. That requires you taking some bone graft from the hip to help it heal. Okay? Option number 3 is a posterior lateral fusion where you just lay the bone on the side here. Okay? Now that's the simplest fusion you can do, and it's the quickest. Probably takes only 2 or 3 hours. But the downside of this surgery is that it might not heal. The posterior lateral fusion, where you just lay bone here, heals 70% of the time. The fusion from the back, where you scoop the disc out from the back, heals 85% of the time. The front back fusion heals 95% of the time. Okay?
So that one takes longer though, the front back?
Yeah, the front back takes 2 hours in the front, probably 2 or 3 hours in the back, so you're looking at a 4 to 5 hour surgery. The surgery all from the back probably takes about 3 or 4 hours. It's also, you've got to go in the back and you've got to take the pressure off the nerves at the upper 2 levels too, at L2, 3 and L3, 4. So that's other work that has to be done.
So he's really got 3 spots that he
3
needs work.
spots that he needs work.
Yeah.
2 spots are stable, the 3rd spot has some motion in it.
Now the motion's what?
At L4, 5.
This one right here.
Yeah.
Okay.
Now let me show you how, if I look at your bending x-rays, the motion becomes clearer. Okay? So, actually, okay, if you look at this x-ray, this is looking at you from the side, okay? So here's the front where the belly is, here's the back, and you can just tell the back of this doesn't quite line up with the back of this.
Yeah, I
Okay.
can see that.
Now, what's the other option? Okay? The other option is to not do a fusion and just take the pressure off the nerves. Okay? So what we would do is just go in the back and shave the bone here and make more room for it. Okay? Now, that would take care of the compression of the nerves, but wouldn't take care of the motion there. When you have pressure on the nerves have many different fibers, okay? The outside nerve does feeling, the next layer pain, the next layer strength. So if you squeeze a nerve, first patients go numb, then they get pain, then they get weakness. That's all down the legs, okay? If you take the pressure off the nerve, you have a 90% chance of improvement in leg pain, you have a 50% chance of improvement in strength, and 30% chance of improvement in numbness. Now, having said that, you don't have any leg symptoms.
I did. Anybody asked me that?
That's the problem.
Yeah.
Your main problem is back pain.
Yeah.
Okay, so there's 2 possibilities. One is that the pressure on the nerve is causing the back pain. Okay, and if we take the pressure off the nerve, it would get better. Okay, but that's not reliable. Only 50% of the time do patients get improvement in back pain if you take the pressure off the nerve. Okay. The second possibility is that it's due to all the arthritis in the joints here, in the facet joints, and particularly at L4-5, okay? So that would be one reason to do a fusion at L4-5 is try to help with the back pain. Again, the success rate of fusions for back pain is only 50%, okay?
Yeah, I know people have had multiple surgeries.
Yeah.
Yeah. after that.
I think once you start getting into surgery for back pain is a lot more difficult. Because there are many reasons why people can have back pain. Some are muscular, some are arthritic.
Yeah.
Okay, even though there's disc degeneration here and facet arthritis here, there's also a little bit of degeneration here and here and here. And we're not going to go fusing your entire spine up.
Yeah.
Okay?
Yeah.
So there's limitations to what we can do for back pain. Okay? I think for you it boils down to 2 options, okay? One is you say, well, I want to see if the nerve pressure is causing the back pain. Let's just take off all the pressure off the nerves and see what happens. So we can go in the back, cut the bone out that's pressing off the nerves, and see how you do. That surgery takes about 1 hour per level, so it takes about 3 hours. And you stay in the hospital 2 to 3 days. Once you can walk to the bathroom, have a bowel movement, and tolerate your pain with all pain medicines, you can go home. And that takes most patients 2 to 3 days. Okay.
Then how long after that before you're, it just depends on how it goes, I mean,
There are two parts to surgery. There's the surgical technical side, and there's the response of the nerve to surgery. The surgical technical side, I can tell you, takes 2 weeks for skin to heal together. I can tell you it takes 3 to 4 weeks for muscles to heal up. But the response of the nerves to surgery is less predictable. If the nerve gets better and your back pain gets better, you're going to be way ahead of the patients who don't get better. Does that make sense?
yeah.
So there's a part that's unpredictable. So that's option number 1, okay? Option number 2 is to say, let's take the pressure off the nerve and do a fusion. I want to try to stabilize this bone and see if the arthritis or the instability there is causing the back pain, okay? That would take about 5 hours, and there are options of going front and back or just from the back, okay? But it would take 5 hours regardless. You'd be in the hospital about 4 to 6 days. And same thing, go to the bathroom, walk, have a bowel movement, you can go home. That takes most people 5 to 6 days, okay? That surgery probably takes about 2 months, 2 to 3 months to recover from, okay? You can walk as much as you want to, but no heavy lifting, twisting, or turning until the bones heal together, which takes 2 to 3 months. Once the bones heal together, we let you do physical therapy, and you get stronger, and we mobilize you along. So that's what I think are your 2 options surgically.
Yeah.
Okay, any questions about that so far?
No, I mean, I'm going to look at this again, but I'm comprehending it, I think, for the first time as much as I can. Yeah.
I think it's clear. I
Yeah,
mean, he's
okay.
going over
Good.
so many
I do
different
appreciate it,
things.
yeah.
Now let's talk a little bit about risks, okay? The risks of surgery I divide in 2 categories, spine risks and medical risks. Spine risks include a 1 to 2% chance of infection, bleeding, there's risk of anesthesia, there's risk of nerve injury, and there's risk of dural tear, getting a hole in the sac of nerves. If that happens, I put a couple stitches in it and keep it flat for a few days until it heals. It's usually not clinically significant, but still a complication you need to know about, okay? The other risks of surgery are medical complications because surgery is a stress to your system. And it's no different if you're having heart surgery, knee surgery, or hip surgery, you're at risk for medical complications. Those include things like heart attack, stroke, blood clotted lung, pneumonia. Worst case scenario, heart attack is people die of heart attacks. Worst case scenario, stroke is people become paralyzed from stroke. These risks are very rare, less than 1% combined incidence, but if they happen, the results can be disastrous.
Sure.
So we usually talk about a gamut of risks from more common to less common and less severe to more severe. Okay? Any questions about that?
No, I mean, I think I got that. I mean, I know
And
you
he's
take some risk.
diabetic too,
Yeah.
so that's medical in the medical line.
That increases your risk somewhat,
Yeah.
is the diabetes.
But he's a very well controlled diabetic now.
Where's your last sugar here?
6.4.
Oh, and did you have a hemoglobin A1C?
But that's what it was,
Oh,
6.4.
that's very good. Good
6.2
job.
before that.
That's very good.
It's actually when I started on insulin a year and a half ago. No, other than that, it was about 6.9, 7. As soon as I tried insulin, I said, my gosh, it's so much easier to control with insulin.
Yeah, that's good.
So I went there.
So, yes, that does increase your risk somewhat. If you do decide to have surgery, you have to come down once here to meet our medical doctors. It's one of the rules, hospital rules. If you come down to a hospital for surgery, you need to be seen physically by a medical doctor first.
So would you do it, or would it be somebody else?
Well, I would do the surgery, but I wouldn't be doing the medical evaluation. Okay, those are medical doctors or anesthesiologists who look through your heart, your lungs, all those things. You could get most of your lab studies done at Redwood City, but if you wanted to have surgery down here, we'd have to have you come down and do one checkup with our people. Okay. My waiting list for surgery is about 3 to 6 weeks, depending on what type of procedure you want to do. It's a little bit longer if you want to do a front and back procedure. Front and back procedure, I have a vascular surgeon help us, and if you're interested in that, what I would need to do is get a CT scan, look at the status of your aorta. Aorta is the big blood vessel in front that sits in front of the spine, and you'd have to meet with our vascular surgeon to see if you're a good candidate for that. But I think you probably are.
So what, go ahead.
I'm just reading over here on when you do a fusion and taking it from the hip
Yeah.
It says this little thing I got out of your slot over here, it says it's very, very painful.
It is initially.
You know,
It usually gets better over time, but it is
And
usually
that's
initially.
where you've taken the bone graft. And do you usually take a person's own bone graft, or do you?
Depends if I do it front and
Okay.
back or back only. If I go from the
Yeah.
front, I use that special protein, bone morphogenetic protein, to stimulate the bone to heal across.
Okay.
If I go from the back, then I do take some bone graft from the top of the pelvis. It's more reliable. One thing I was curious about, you did a facet injection and medial branch block. Did those help you or not?
No,
Not at all?
no, that was, no, it didn't help at all. And he said, hey, let's try it because it may work. It didn't work. There was absolutely no help from it.
But one of the epidurals did help.
The first one.
First epidural.
The first one, I mean, I had leg pain. I never had leg pain after that.
But it did help with your back pain.
Yes, it did.
It did. Okay.
Oh, yeah. And that's why I thought if I repeated it, but we
Oh,
repeated it with 2 doctors and neither one helped. And one was the original one that gave it to me the first time, so
Right.
and that was the last one.
What I would say is I would want to get a CT. If you decide you want to have surgery, what I would do is get a CT scan of your back and look at how good this facet joint is at L4-5. If it is reasonable, then I might suggest just taking the pressure off the nerves and seeing how you do first.
Okay.
And if you don't get better, then we can always move to a fusion down the line. Okay. So that's one option.
With the second operation.
With the second operation, yes.
Because that was the easiest. You said just take the pressure off and
It's-
see if that would
Take the
work.
pressure off, one place or 3 places?
All 3.
All 3.
All 3.
Mhm.
And everybody's different. I mean, I've run into 2 people that have had these
Yeah,
spinal
right, so-
stenosis, and I know everybody's different. Of course, they said, I mean, both of them,
Yeah.
within a month, they were out walking around. They said it's fantastic, but you never know. You never know.
Well, it depends. Depends on a number of things. And remember, the main problem you have is back pain, whereas a lot of them probably had leg pain or leg
Yeah.
function.
Yeah, a lot.
It could be.
Yeah,
That
everyone
could
you
be.
mentioned
I
said they
certainly
had the
didn't
leg
try to
pain.
diagnose them.
Yeah.
That's for sure. Just anecdotal, I understand that, but so what would, do you have any thoughts? Do you think it, I mean, from what you know now, or do you think take the CT scan and go from there?
Take the CT scan. My thought right now is I would consider being conservative and starting small first before
Yeah.
going to a fusion. Just because if it was due to the joint arthritis, the block there should have helped you.
Okay.
Okay, you understand what I'm thinking? If something is causing the pain, it stands to reason if you numb it up, that pain should get better. Okay, so if the arthritis in that joint was causing your pain, then when they numbed it up with the medial branch block and the facet injections, it should have gotten better.
Yeah.
But it didn't.
It didn't.
Whereas
None.
when they injected the nerves, your back pain seemed to get a little bit better. Okay, so my thinking right now is maybe just take the pressure off the nerves and see how you do. And if you don't do well, then bring it back and do a fusion.
Yeah. Well, I'm certainly for the more conservative. I think let's go ahead and do the CT scan. But can they do that here or
Sure,
Redwood
you
City?
can do it right now if you want.
Oh, let's do it now over here.
Okay. All right.
Let's
Any
do
other
that.
questions about surgery? Okay, it's a lot.
It is a lot.
Yes, well, I'm going to look at this again, but
Yes.
the 2 questions they tell you on the news ask, how many of these have you done, and what's your success rate?
I do about 100 decompressions a year, and I've been doing it for about 9 years now.
Wow.
And I do about 70 to 80 fusions a year. And I've been doing those for about 8 or 9 years now. So I've done a good number of fusions. It's one of the more common operations that I do. Okay. What was your other question? Oh, success rate.
Success rate, yeah.
Success rate is very good for leg pain. For people with classic symptoms, it's very good. I'd say above 90%. But for people with back pain, it's really mixed. Okay, some people, you take the pressure off the nerve, they respond real well. Some people they don't, and that's why I put a 50% number on it, because 20 years ago we did thousands of spinal fusions for back pain. That was kind of a perfect storm situation in the fact that that's when MRI first came out, that's when fusion first came out. Everyone who had back pain got an MRI, and everyone who had an MRI had black discs like this. And people said, well, those black discs must be causing the pain, let's cut it out. So that's what a fusion was. You cut it out, put bone there, and fused it. What they didn't know was a lot of people without back pain also had black discs. Okay? But anyways, thousands of patients got fusions back then, and they're not doing very well as a group. I think only 50% of them are better, and their average pain relief is 50%. The other half, 30%, were worse, and 20% were about the same. Moreover, once you fuse two bones together, you put more pressure on disc space above and below, and they can fail. The rate of adjacent segment failure is about 4% per year. So
Wow.
10 years after spinal fusion, 40% of patients have had another spine surgery.
Wow.
It's a bad story overall, but I think it goes back to the fact that we just don't understand back pain. You know, I think we can do all the tests, the block, look at different factors, but I don't think we understand it. In my mind, we try to do blocks to try to pinpoint it. Okay, inject the nerve. Does the
Yeah.
nerve get better or not? Inject the joint. Does the joint get better or not? But there's some things that we can't replicate, like motion. Say the motion is causing most of your back pain. We're not able to replicate that. Okay? And that might be the case. But I ask you the question, does bending forward bother you? And doesn't. So
No, that's
it would
not so
stand to
much.
reason if the slippage was causing the pain, then bending forward would hurt a lot.
Yeah, no,
So
I don't.
when I put it all together, I seem to think that I don't know what's causing your back pain, but my best guess is it's pinching of the nerves.
That. I mean, for me, it seems that way. My concern, and I'm aware of this. My nurse practitioner, my wife, and everybody that knows me well is always telling me, Bob, you need to lose weight. I defend myself by saying, well, I have lost 70 pounds, but I need to lose. I know that would help, but I just wonder, Now you said if we did this conservative one, then how long? What was the recovery period to get on that one?
Total recovery time will be between 3 and 4 weeks.
3 and 4 weeks. Oh, okay. If we did conservative, well, that makes sense to me.
Let me take a quick look at your back again,
Yeah.
okay? Can you just scoot forward just a little bit? There, that's perfect. I'm going to figure out, does any of this hurt you?
Well, the lower you get, the more it hurts. Yeah, right. Yeah, right there.
And that's when most of your pain is centered, right?
Yeah. That's.
Is that the exact same pain or a different pain?
Well, up above is where up above and to the right.
Right
Yeah.
there.
Oh, there you go. But that right there. That.
Right there.
Yeah, a little bit to. Yeah. Oh, yeah. Up to the left, right there. Yeah, and up a little bit.
Right here.
Up a little, to the right.
Here.
Up a little bit. Just a little. Yeah. There you go. That. Yeah. You hit something there. Whatever that is.
Okay.
Whatever that one is. You got it there.
Okay. Let me do something. Let me tape this to your back, and I want them to do an X-ray with this tape to your back. Okay?
Or you want to put a pin mark? We can
No,
put a pin mark.
because they can't do a good X-ray. Let me get Abe in here a second.
For your appointment, or give them a couple of days at any kind of
Okay, here we go. I'm going to have them get an X-ray with this paper clip so I can see that and where it is in relation to the rest of your spine.
Okay.
Okay, and then after that, take it off and get your CT scan.
All right.
Okay?
Can I ask you just one question?
Of course.
When he gets up from this recliner chair,
Uh-huh.
a lot of times he'll take his legs and he'll go like this,
Mm-hmm.
to get himself up instead of pushing up with his hands.
Mhm.
Does that put more pressure on his nerves when he
Bends up.
goes like this and then shoots out his leg trying to get himself forward instead of just pushing up? Seemed like that would put more pressure on the, maybe do more damage.
It's not, neither of those things are going to cause a lot of damage,
Okay,
but it is a lot of banging on your spine.
yeah.
I think bending forward is probably a little bit better. If you
It-
bend
it-
forward.
I just do it. It helps me have less pain. I mean, I have stairs that I crawl up using all fours
I'm
just because
talking
there's
about
less
trying
pain.
to put more pressure on when you get
Yeah.
out of your recliner.
I just do whatever works best.
And instead of pushing up.
I know what hurts and I know what
I
doesn't.
know, but I'm saying further damage,
Yeah.
honey.
So 2 things I want today. One is I want you to get an X-ray with this paper clip on, and the second is a CT scan.
All right.
And I'll schedule a telephone conversation for us to talk in a couple weeks. Okay.
Okay.
Meanwhile,
sounds
you
good.
can think about what I said, and
Yeah.
if you decide you want to have surgery, let me know. Okay.
Okay.
Thank you so much.
welcome.
Really
Thank you very much. Appreciate it. It's very, very helpful in your explanation. I
Yeah.
understand.